key components for fitness required for middle distance runners 5 to 10k. Stamina, cardiovascular endurance, strength, power, speed, flexibility, and coordination. Stamina. This is the ability to sustain prolonged physical effort. This is achieved by training the body systems to process, deliver, store, and utilize energy. Stamina is determined by power and endurance, efficiency of respiratory system, efficiency of circularity system, and lung and aerobic capacity. Cardiovascular endurance. Endurance is the ability to resist fatigue, and it's the ability of the body systems to gather, process, and deliver oxygen. Contributory factors are VO2 max, cardiac output, heart rate, economy, lactate threshold, stroke volume. Strength. This is the ability of a muscular unit or units to apply force. Strength depends on the type of muscle fibers, age, limb and muscle length. Power. There are two types, aerobic and anaerobic power. Economy again plays an important role in power. Economy. This relates to the quantity of oxygen required to move at a particular speed and generate power. The stronger the muscles, the greater the endurance, and the less oxygen and energy required to be transported to muscles, adding to efficiency. Running economy can be improved by strength training, altitude exposure, and training in warm environments. Type of muscle fibers. Type 1 muscle fibers have a slow contractile period, but have a high resistance to fatigue and increased strength. Type 1 fibers also add to endurance. They have a slow contractile rate, but their resistance to fatigue is very high. Fiber type. Type 2B muscle fibers. They have a high contractile rate and power output, but have a low resistance to fatigue. They allow you to develop an explosive start to a 5 or 10k run.
The most important muscle fibers used in mid-distance running is a combination of slow-twitch fibers, or also known as type 1 fibers, and type 2A fast-twitch muscle fibers. Slow-twitch, or type 1. Mid-distance running does not require maximal effort, therefore no explosive movements or fast contractions are required. Slow-twitch fibers are the body's main use in continuous, sustained movements. These fibers do not contract forcefully and in turn require less energy when contracting. They are more effective at consuming oxygen to create more ATP for these sustained continuous muscle contractions over long periods of time. Therefore, these muscle fibers are the most ideal and most suitable for mid-distance runners. These muscle fibers are also fatigue resistant, which makes them suitable for mid-distance running. As an athlete progresses throughout a 5 or 10 kilometer run, slow-twitch fibers begin to fatigue and can no longer contract as efficiently as before. In this scenario, the body calls on type 2A fast-twitch muscle fibers. These fibers are designed to generate short bursts of strength and speed, better than slow-twitch. These fibers produce the same amount of force per contraction as slow-twitch fibers, however, are given their name due to the fact that they can generate this force much quicker. These fibers are important for mid-distance runners in order to allow the body to increase the speed and generation of movements when entering the last fraction of the run, when the runner tends to increase their speed. However, these fibers are not as fatigue resistant as slow-twitch fibers, therefore training to improve these fibers is crucial in mid-distance runners.
Speed. There are 3 components to speed. Acceleration, which allows you to move from a stop position. Absolute speed, which is the highest velocity you can attain. And speed endurance, which is the ability to maintain absolute speed. This allows you to develop forceful, quick strides. Flexibility. This is the ability to attain large ranges of motion at the joint, for example, in order to have long strides. Coordination. This is the ability to move the body in order to accomplish a task.
There are 3 main energy systems: the oxidative system, otherwise known as the aerobic system, the glycolytic system, which is anaerobic, and the ATP-CP system, which is also anaerobic. The oxidative system is the low-power, long-duration system. It provides energy slowly. It has an almost unlimited supply and produces ATP through fatty acids or glucose. Fatty acids take longer to break down. Therefore, if the body cannot provide oxygen quickly enough for this breakdown, glucose must be broken down first. Should the glucose become depleted, the body will turn to fatty acid sources. ATP is produced in 3 ways. It goes through the Krebs cycle, the electron transport chain, and through beta oxidation. Krebs cycle is a sequence of chemical reactions which oxidizes glucose, which was initiated during glycolysis. Acetyl coenzyme A goes through the Krebs cycle and is broken down to carbon and hydrogen, and in the end 2 ATP molecules are created. In the electron transport chain, hydrogen is that is created in the Krebs cycle can become acidic if not tended to. It combines with enzymes NAD and FAD and goes to the electronic transport chain. Through chemical reactions, it combines with oxygen to produce water preventing the acidity. In beta oxidation, it breaks down triglycerides, which is stored fat. This process is called lipolysis. Lipolysis breaks down triglycerides down to glycerol and fatty acids. Beta oxidation is a series of chemical reactions downgrading triglycerides to acetyl coenzyme A and hydrogen. The acetyl coenzyme A then enters Krebs cycle and is broken down like glucose. Next, there is the glycolytic system, which is anaerobic. There is slow glycolysis and fast glycolysis taking place here. Fast glycolysis is a high extended effort and more power is generated, but pyruvic acid is converted to lactic acid and the body becomes fatigued quickly. Slow glycolysis would be the most appropriate for mid-distance running. Less power is generated, but pyruvic acid is converted to acetyl coenzyme A and goes through a series of reactions called Krebs cycle, as I mentioned before, and more ATP is produced and fatigue is delayed. Extreme fatigue can be avoided in slow glycolysis as compared to fast glycolysis, but relatively less intense effort can be expressed. Slow glycolysis is more suited to mid-distance running. Maximal effort is not required in this case, just submaximal effort, which is maintained through slow glycolysis, as well as the oxidative system. And the last system is the ATP-CP system. The ATP-CP system is an anaerobic system. The body calls on this system for quick contractions and explosive movements. Because mid-distance running requires submaximal effort, the ATP-CP system doesn't play an essential role in mid-distance running. However, the runner may call on this system in the beginning or end fraction of a race when the runner increases their speed in order to create more forceful movements.
Movement analysis. Within movement analysis, we will talk about the motions involved, the muscle groups being used, and the muscle actions during running. When the leg hits the ground, there is an eccentric contraction of the hip extensors at the hip, and at the knee there is an eccentric contraction of the knee extensors, and at the ankle there is an eccentric contraction of the plantar flexors. The leg pushes the weight of the body off the ground and propels the body forwards. Within this movement, there is a concentric contraction of the hip extensors, and there is a concentric contraction of the knee extensors, and there is a concentric contraction of the plantar flexors. The leg has been pushed off the ground and it is now in the swing phase. The leg is bent, which means the knee is in a flexed position. The knee is then brought up towards the chest. At the hip, there is a concentric contraction of the hip flexors, and at the knee, there is a concentric contraction of the knee flexors. The leg straightens and prepares for landing. During this motion, there is an eccentric contraction of the hip flexors, an eccentric contraction of the knee flexors, and an eccentric contraction of the dorsiflexors. Some of the muscles being used here are the hamstring, the glute max, bicep femoris, the semimembranosus, the semitendinosus. There's the vastus, the vasti, the rectus femoris. There's the gastrocnemius, the soleus, flexor hallucis longus, tibialis posterior, and flexor digitorum longus.
Patellofemoral pain syndrome is also known as runner's knee. It is represented as anterior knee pain that is aggravated by activities such as ascending, descending stairs, sitting with knees bent, kneeling, and squatting. Diagnosis. Not one test will confirm patellofemoral pain syndrome. It is commonly seen as a diagnosis of exclusion, meaning diagnosis is formed after several pathologies has been excluded.
So
I'll place my thumb and wedge on the superior of the patella. I'll ask the patient to contract their quads as I place pressure downwards and inferiorly. If there is pain or the patient is unable to do this, this is indicative of patellofemoral pain syndrome.
We have demonstrated Clark's test. Iliotibial band syndrome is a common knee injury that usually represents with pain and or tenderness on palpation of the lateral aspect of the knee. Relative to runners, this repetitive motion causes extensive friction between the lateral femoral epicondyle and the iliotibial band tract. Muscle weakness of the hip abductors is also associated with iliotibial band syndrome, as this causes increased hip internal rotation and knee adduction. This was found as a significant issue for athletes with iliotibial band syndrome. Tests for iliotibial band syndrome include Uber test, Wren test, and Noble's test. To conduct Wren test, we ask the patient to stand on the affected leg. Then bend the knee 30 to 40 degrees of flexion. The ITB will be put into direct contact with the prominent lateral femoral epicondyle, and a familiar pain as in running will be elicited. This indicates a positive test.
So I'll get my patient lying on their side. They're going to abduct their leg with a slight extension. I'll place my hand on the pelvis to stabilise it. At this stage they are grade 3. I'll apply slight pressure, and if they're able to resist this, it means that their IT band is working. At this stage they're grade 3, 4 or 5.
This is the calf squeeze test. We're going to have our patient lying in prone with her feet slightly off the bed. So we're going to squeeze her calf a couple of times, and as you can see we can observe plantar flexion in the ankle. If plantar flexion does not occur, it is a sign that the Achilles tendon has been ruptured. What you can do is palpate the Achilles tendon and the plantar surface of the foot where the plantar fascia is, just to see if there's any tenderness or if the patient experiences any pain when this is done.
The iliotibial band syndrome can occur when the muscles of the gluteal and hip region may be weaker. Often it is present due to poor biomechanics of running. It can also be a byproduct of sudden increase in training. Iliotibial band syndrome materializes as a burning or sharp pain on the lateral part of the knee. It can often become swollen or red. Iliotibial band syndrome can be helped by offloading the IT band for a period of time. Achilles tendinitis is friction or strain upon the calcaneal tendon. It can occur with sudden increase or intensity or duration of exercise. It can also be affected when exercise is repetitive, as a running stride would be. To help prevent Achilles tendinitis, an athlete should gradually increase their exercise. By cross-training or stretching, the body can become more limber, therefore reducing the chance of strain on the Achilles tendon.
Plantar fasciitis is an inflammation of the plantar surface of the foot, often described as a sharp, tight, painful sensation at the base of the heel that can be anywhere from uncomfortable to excruciating. This usually occurs because of overtraining and overuse, and maybe even improper footwear. What you can start with is reducing load on the athlete's foot by getting them aquajogging, or if you have access to it, a anti-gravity treadmill. This will let the athlete run or do the same pattern without having the same body loads as running on the feet. The second thing that you can do is lots of weightlifting that doesn't involve standing. Things like leg extensions, hamstring curls, and glute ham developers. Even building up the calves by doing calf raises and heel drops, as long as the patient or the athlete isn't in too much pain. Thirdly, you can roll the feet on a golf ball, but excessive rolling has shown through studies can be negative. The final thing you can do is ice the feet, which may provide much needed relief if the athlete's in a lot of pain. But again, this is only for pain relief. Long-term diligent stretching and strengthening of the muscles around the feet will address the root of the problem. Exercises like aquajogging, swimming, weight training, yoga, and others can be employed to reduce the load on the feet while improving VO2 max and the other physiological determinants. Patellofemoral pain syndrome is highly prevalent in runners and often leads to functional limitations. It causes serious pains in the knee, and the main reason it occurs is because of training errors and decreased lower limb strength and control during running. Patellofemoral pain syndrome is also commonly referred to as runner's knee and has been reported as the most frequent running injury, ranging from 19 to 30% of diagnostics in women and 13 to 24% diagnostics in men. Several studies have reported that patellofemoral pain syndrome in runners could be related to deficits in lower limb strength. Cross-sectional studies suggest that runners with patellofemoral pain syndrome may have strength deficits in their knee extensors or hip abductors compared to runners without patellofemoral pain syndrome. In the course of rehabilitation of athletes with patellofemoral pain syndrome, the first thing to consider is that they might be in a lot of pain. So the program could simply focus on modifying training loads in order to manage that said pain. What you're trying to achieve is to promote tissue adaptation within their functional limits. Second, exercises targeting the quads, hips, and core muscles should be prescribed to increase the capacity and sustain loads by strengthening or improving lower limb control. A gain analysis could also be done to see if the athlete's running correctly. And what has been proposed through many studies is to increase step frequency, run softer, and avoiding heel strike.
Running economy is the aerobic demands on the body during exercise. It is the relationship between oxygen consumption and running speed. A better running economy means that the body uses less oxygen and less energy. To achieve a better, more efficient running economy, an athlete can take part in strengthening and conditioning exercises. They could also train at a higher altitude or in a warmer environment. By modifying a training scheme, the athlete can still maintain fitness while also healing an injury. Swimming is a good non-weight-bearing workout. By availing of a local yoga or Pilates class, an athlete can also build up their flexibility and conditioning, which would be beneficial to their bodies to help reduce injury. Foam rolling is also of use to reduce the possibility of injury. By taking part in a strength training, the body can build up weaker muscles. Non-weight-bearing exercises, such as cycling or swimming, are also good for the cardiovascular system without putting too much strain on the joints or appendages. Hot yoga is a good way to limber off while also allowing the lungs to adjust to a warmer climate.
VO2 max. This is the maximum amount of oxygen consumed by the body. It adds structure to training, giving athletes a competitive endurance edge on their performance. The more oxygen transported to myoglobin in muscles, which stores oxygen, the less likely for muscles to fatigue. Lactate threshold. This is the maximum effort that an athlete can maintain for an extended period without the production of lactate in the blood. The greater the threshold, the longer the athlete can perform before a buildup of lactate. If there is lactate being produced in the muscles, they are not receiving enough oxygen, causing extreme burning and fatigue.
So in summary, we brought you through a journey of the key components that are involved in 5K and 10K running, energy systems being aerobic, anaerobic and phosphagen, a detailed movement analysis encompassing all movements for that particular sport of running. In task 2, we discussed the most prevalent injuries in the athletic population, being IT band syndrome, Achilles tendonitis, plantar fasciitis, and patellofemoral pain syndrome. We've shown you how to assess and confirm these injuries, and then after that, in task 3, we've showed you how to rehabilitate an athlete with any of these injuries, and the physiological determinants for those sports in relation to rehabilitation. Thanks for watching. See you next time.